enjoy the journey of exploration. A PhD is worthwhile if that's my key message. Evaluate ourselves just as much as and I mean this, they are genuinely in need of people with some degree of clinical experience. It's entirely plausible to be involved in the medtech space whilst continuing your clinical career.
Hey guys, welcome back to the More Than Medics podcast. On this week's episode, we welcome Dr. Nick Hayward, a radiology registrar with a rich academic background, including a master's in natural sciences and a PhD in neurobiology and medical imaging. With experience spanning research, academia, medtech consulting, and working with industry, he provides valuable insights into navigating diverse career paths in medicine. Nick offers a lot of practical tips and reflections, so we really hope you enjoyed this episode. So thank you so much, Dr. Nick Hayward, for joining our podcast today. It's lovely to meet you. Can you just briefly introduce yourself to our audience?
Oh, sure. Thank you. Yeah. Thank you very much for having me, Yasmin. It's a real pleasure to be here. So my name's Nick. I am a radiology doctor at the moment, ST4, so resident radiologist. But I'm also a neuroscientist, academic clinician, and I do some advisory work for medtech companies. I've got a few hats that I wear and really been designing a portfolio career around research and technology for, over a decade now. So yeah, I'm currently based at Oxford University Hospitals, but I have an affiliation with Aalto University, which is a great university just outside Helsinki in Finland. So hopefully that's me in a nutshell.
Awesome. And so I was reading up on you slightly, and let me know if I get this right or not. You've done a master's, is that at Cambridge? And then you did a PhD, and then you went to med school. Is that the order of events?
Yeah, that's bang on. I did my bachelor's and master's as a natural scientist. I was very much a pure scientist. I wasn't interested in medicine at the time. And yes, that was at Cambridge University, St Catherine's College. Went very well, really enjoyed the fundamentals of research and science. And that was where I was really most interested in my career. So I did, yes, you're right, go on and do a PhD. And that was in neurosciences and medical imaging. Now, it was during that time that I realized, I think sharing all of this research knowledge, academic knowledge, biology, technology with society is kind of what I most enjoyed. And it therefore just kind of made sense as my research got more clinical to move over to medicine as well. So yeah, you're absolutely right. I did the then graduate program at Imperial College London and did well there. And that's the academic route for me into medicine. So I was, I was around 26 when I went to medical school. And you're right, I'd done a couple of degrees before that as well.
And what inspired that transition other than your work becoming a bit more clinical? What else inspired you to transition from a purely research and academic kind of career to then include that clinical side?
Yeah, I think there were lots of push factors and lots of pull factors as well. So the push factors out of research at the time, it was shortly after the financial crash around 2007, 2008. And I started to realize the more senior you get in academia, the more you have to apply for your own research funding, the little more like entrepreneurship it can be. So now that was exciting in some ways because my research was going really well. But then I realized, well, hang on. How do we make these activities sustainable? So then there were the pull factors into medicine itself. Now, I don't really have a strong family background in medicine. My mum, she's a retired midwife, but really I realized that it was a natural transition to be able to share what I was doing with society directly by looking after patients. So I thought, okay, I've just got the passion. And what I did during my research time, during my PhD, I spent a lot of time at a university hospital getting experience just voluntarily with medics, intensivists, mostly neurosurgeons, because it was related to my PhD studies. And they inspired me as well. They said, look, you're one of those individuals who can do the research, but you've got some ability to interact well with patients, to handle difficult complexity under pressure. And they really were enamored by my enthusiasm. I was just blown away by the kind of work that they were doing. And I thought, it would be a wonderful extension of the work I've already done and an opportunity to grow, an opportunity to be even better positioned for society in terms of sharing what we do in healthcare. And yeah, so I took the plunge, I applied, and my first choice was to go to Imperial because they preferred people with PhDs who were going to hopefully be academic clinicians of the future. Amazingly, I got in, and the timings were just nice because it was coming sort of towards the end of my PhD. I had about a year to go if everything was going well, and it was. So I managed to just about complete my PhD studies and then go and do medicine. So push factors and pull factors. And do you know what? Brilliant decision for me personally. I'm just glad and grateful to be able to have done a bit of both.
Yeah, that's amazing. Um, so I guess, well, you've come into medicine in a very different way to pretty much everyone. With I'm guessing, a bit of a superpower in terms of research abilities. Having that, would you have any advice for med students not having a PhD and a master's? What are your sort of top tips, would you say, for med students and also resident doctors as well, who want to sort of maybe get the first publication or further their research career?
Yeah, Martin, it's a great question. The luxury of doing things as a basic scientist is that you have time, protected research time. Once one becomes, entrenched in the medical system, let's call it, whether that's working in the NHS or working hard at medical school, it can be really difficult to find that protected time. So, top tip number one from me is to try and design opportunities if you're really keen on research, opportunities where you do actually have protected time. So, for example, I know you guys were involved with your intercalation. So, that's something you can do at medical school. Not all medical schools, but some medical schools, you can literally take time away to focus on research or education or management, for example. And I think it's crucial to have that because that allows you to do research with integrity. What I mean by that is you can work with other great researchers. You can step away from medicine completely for a while, which can be really helpful at the early stage of your career, and dedicate yourself to a project such that it becomes, again, sustainable over a reasonable amount of time. It can be tricky if we sort of pick up the odd piece of research here and there, get involved. That's fine. I would definitely encourage that activity. But if you really want to get deep into research, I think making sure that there is protected time is rule number one. So how do you do that? Well, let's put some meat on the bone. So when I was an academic foundation doctor, that's the point. I was a foundation doctor, but I managed to get myself onto the academic program. And then I had a 4-month protected research time. And that was brilliant. I was at the University of Surrey. I had the chance to work with big data, all related to my interests at the time, which were anesthesia and intensive care medicine. So that was great. There was a ring fence period of time. There was a really good team around me. So I wasn't just trying to do everything on my own. I had really good colleagues. And then again, so I was very fortunate. My first bite of the residency cherry was, or should we say, the registrar cherry was anesthesia and intensive care. And I actually was lucky enough to win an academic clinical fellowship and have 9 months of protected research time in 3 years, which is a pretty big chunk of one's clinical career. Now, of course, these opportunities are really competitive and can be really tricky to get them. So tip number 2 would be small steps. If the initial projects you do, small projects here and there, start to become really exciting, that's when maybe you can step away from the traditional pathways on your own because there are funding schemes out there for research, and maybe you just take a pause on whatever training program you might be on. As I say, you can even put a pause at medical school if you're doing something academic. If you want to sustain that research career, it might be appropriate to do what I did during my anesthetics period. After my research was going well again, I took an out-of-program research placement, and I managed to orchestrate this myself by networking very carefully and finding other researchers who were happy to have me come along as what I was then as a postdoctoral researcher. So again, protected time, out-of-program research. I wasn't leaving my training pathway, but I was getting the opportunity to step away and really dedicate and focus myself on that research period. So yeah, those are some of my top tips about making it sustainable. Number 3, in terms of the tips, would definitely be finding the right people.
Mhm.
So if you're to gonna really, if your research career really gets going, you're thinking about a PhD potentially, or an MD, whatever it might be, or maybe just getting involved in a project that you hope will lead to some publications. A lot of it's about your supervisor. So finding a really, really good individual or group of individuals. I had two fantastic professors for my PhD, Professors Olli Grön and Asla Pitkänen in Finland, where I was based for my PhD. I would say that having the right people is crucial because they're going to support you. You're going to be working a huge amount with them. And sometimes a clinical supervisor may not be the best choice because they might be too busy clinically. My supervisors were, of course, basic scientists, so they had much more time, and it was just a different ecosystem, really, allowing me to flourish as a new researcher. But that's not to preclude fantastic clinical academics. For example, my professor in Southampton is Mike Grocott. He's a wonderful, wonderful gent, and he was very supportive of PhD candidates coming through. So I think it's crucial to find the right people and particularly the right supervisor if your research really gets going and you're thinking about doing it potentially 3 years or 4 years or more for a PhD.
I wanted to also ask, um, because you explored research first before the clinical side, how do you think that shaped your perspective as a doctor, and as a researcher? Because I'm thinking, for example, some students are interested in research because the impact it can have on patients' quality of life. For example, if you look at treatments, but a lot of the time students will do clinical first and realize the impact of research and then go into research. So with that different kind of trajectory that you took, how did that change your perspective on things?
That is a great question because it was really, really eye-opening when you go into medicine from research because it's like, oh my word, we think from the movies, we think from our imaginations growing up that medicine is sort of a very research intensive specialty. And it can be, of course. I mean, there's so much clinical research internationally. But when you start working as a medical student and when you go into your foundation years as a doctor, it's so much about being a practically useful individual in so many situations. Now, of course, research has its practical considerations too. But I was actually surprised. For example, I'll give you a clear example of just how there's a void between where we are between in terms of research and where the clinical practice is at. Um, I've noticed this. For example, when I was doing imaging research, so brain imaging research during my PhD, we were looking at very subtle changes in the brain that were region specific. And yet, when you go into a clinical setting, we still, even in neurointensive care at the top institutions, we still tend to treat, even 20 years later now, we tend to treat the brain as sort of one homogeneous entity. Um, and again, I call it the void. You know, there's this huge gap between where we are clinically and where we are in terms of research. And this is not just true for neurosciences. We see this in a number of different specialties. And I think that was a real eye-opener because you think, my goodness, like there's all this amazing research going on, but actually being a jobbing doctor is much more about the practicalities. So for me, it was a real culture shock. There was much adjustment. Also, I noticed the hierarchy within medicine can be quite strong sometimes. So, as a reasonably respected researcher in an international research group with people from all around the world, where I would work where my ideas were very welcome. Yet, naturally, as a foundation doctor with a busy ward round and a top professor or surgeon, yes, of course, you might have some ideas, but you're still at that learning phase. And even now, as a resident doctor in neuroradiology, um, there's so much for me to learn. So, yes, you're always learning in research, but I think the culture is somewhat different as well. So, let's just say my perspectives and my opinions, particularly in the early stage of a clinical career, are not quite as valid or not quite as welcome in some places. Now, again, that's totally understandable. I'm not critical of that. It's understandable because that's the way medicine has to be on some level. We have to, make sure that the entire team is on the same page and that we do what practically needs to be done for our patients. But it's a great question you asked because my perspective as a researcher where I was respected and sometimes sort of abstract ideas would be valued. I had to change when I came into clinical medicine because it was a little bit more dogmatic, a little bit more hierarchical, and just a little bit more pragmatic and practical too.
Mhm. And why do you think there is this void between kind of what, yeah, like you said, what researchers do compared to what clinicians do? And then as a person who might want to still be a clinician but do research, how do you kind of navigate that?
Yeah, it's tricky. I think that the first big void is in relation to where the research is at and where the clinical practice is at. It can be a little bit disheartening sometimes to think that, there's so much research going on, but it hasn't yet been translated into clinical practice. And that's something I'm quite passionate about, is how do we facilitate that process?
Mm-hmm.
I think there are many reasons as to why that void exists. First and foremost, of course, when taking care of people, we need to make absolutely sure that whatever we do in clinical practice is safe and effective. And of course, it therefore takes a very long time for clinical technologies, and specifically new clinical technologies, to gain traction, to get momentum. And that's all for very good reasons. And I'm personally very interested in clinical safety, for example. So I'm quite passionate about that. But I think it's one of the reasons as to why what we see in research is sometimes further on technologically than where we are in clinical practice. And there are many other factors as to why research takes time to really get traction in clinical settings. There are so many different variables, and I won't go into all of them tonight. But I think the key one is our focus rightly on safety and efficacy, and just an understanding that technologies take time to gain evidence and to gain support among all of the stakeholders, all of the people who use or experience those technologies. With regards to the kind of the culture I've hinted at, where in a research environment, sort of everybody's welcome and ideas might be flowing, I think it's really just a question of different ways of working. Because as I said, in a clinical context, we have to make sure that we are very robust, very thorough in our decision making, and that we utilize as much senior clinical experience as possible for every patient, every decision. And therefore, it just makes sense. It's no surprise to me that the culture is a little different between those two camps. For me personally, I think the solution is just don't be afraid of it. I mean, the best thing about a portfolio career is the opportunity to experience different working cultures. For example, it's a different culture again in the pharmaceutical industry or in the medtech startup space. And I've just always been passionate and excited about experiencing those different cultures. I'm not critical of any of them. I think they're just different. And if you're adaptable, you're flexible, and you're open to a portfolio career, then it's a good idea to at least be open-minded and receptive to just different ways of being, different ways of working.
I think that's good advice. Just, putting yourself out there, like, don't be afraid of it. I think that's just advice you put generally on a lot of opportunities, especially if you want it, like you said, have a diverse career. And I just want to ask a question. So you mentioned earlier about the importance of having protected time to help students and resident doctors explore research further. And obviously one way you can do that is through PhD. So at Imperial, for example, you can do the integrated PhD, where you do it halfway through your medical school degree. But I kind of wanted to put a spin. Is pursuing a PhD worth it?
Oh gosh, great question. Just to check, the question was: is the PhD worthwhile? Is that what you're?
Yeah, is the PhD worthwhile?
Someone asked me this recently at work, literally a few days ago. They actually asked it in a slightly different way, and I sort of had to hesitate a bit and think, oh, that's interesting, because for me, my PhD is one of the pinnacles of my career, academic, clinical, whatever, however you look at it. I really felt like, in all honesty, on a very personal note, those years I was really growing in wonderful directions, both personally and professionally. My understanding of natural sciences, of neurosciences, and medical imaging. I mean, what an opportunity. It's an absolute privilege, quite frankly, to be doing that kind of work and to be funded and so on. I think the answer to your question comes down to your motivation to do it. So a PhD is worthwhile if you go into it with the right motivations. And the reason I say that is, again, due to sustainability. If you're working on a project that's just a little bit, here and there, or a project that doesn't quite sustain your interest, or on a project that isn't particularly well established, and therefore it's likely to perhaps break down halfway through. Perhaps you're trying to juggle too much in your career rather than focus on each thing carefully. Then, yeah, I think it can be actually quite risky to embark on a PhD that way. Personally, it was extremely worthwhile because I feel that now, particularly later on in the clinical career, it's opened up many opportunities for me to continue to do research. For example, I've had my own funding. The PhD title, but not just the title, the process of going through a really detailed, involved project or several projects of a PhD is a demonstration of your capability to conduct research. Prof. Grocott in Southampton used to say to me that a PhD is a passport to do research independently in the future. Now, therefore, hugely worthwhile. And I think you have to look at how worthwhile it might be in two different ways. Firstly, it's the outcomes. You say, like I've just said, that it leads to more opportunities for sure, particularly in the research space, but also in the tech space. People tend to respect those who have, really deep understanding of a certain topic. But also, it can be really worthwhile at the time if it's particularly healthy. And I've seen some very unhealthy PhDs in dysfunctional research environments that don't work well for people. But for many colleagues of mine who have gone through the process, they've come out the other side and enjoyed that process. They've enjoyed the journey and they've got a lot from the journey. They've been to conferences, they've made publications, they've learned a lot about themselves. They've realized, what are the applications of what they do? How can it benefit society? Maybe it scratches an itch in another area of healthcare or science or engineering. And consequently, they become beautifully well positioned to try different opportunities and to explore their careers in areas that perhaps they had never even considered before their PhD. My PhD inspired me to go into medicine, and I don't look back. I really, I'm glad to be both an academic and a clinician. So yes, I think it is worthwhile, but I think you have to be very selective. I think you have to be sure that it's sustainable and that you're going into a PhD for the right reasons, rather than considering doing it just because it seems like maybe it's something to do.
That's so interesting, actually, and really nice to hear how it had such a positive impact on yourself and your career as well. I guess more granularly now, what are some of the things that you notice maybe your colleague clinicians' skills in research that maybe are lacking or need work on potentially that you've spotted a sort of a pattern and that you think, okay, this is something that people don't know about or a certain technique within research or a certain uh, way of doing things that you think people could uh, improve on or learn about?
Oh, great question. I think what I've noticed in clinical research is that sometimes we all, and I might count myself in this category, we all underestimate the complexity of clinical research working directly with either healthy subjects or with patients, but particularly with patients. The huge organizational and administrative challenge that kind of research poses. So to give you an example, if you're dreaming up a study, a clinical trial, for example, I have led one clinical trial in my time, a small clinical trial. Um, I think we all underestimate just how much work it takes to do before we're ready to go ahead and actually do the research. It can take many, many weeks, sometimes months, sometimes even years to get very robust study plans and protocols in place to then run those through the national, wherever you are in the world, that the national infrastructure to ensure ethical approval, to ensure that there is study sponsorship and insurance within the host institutions of that, to do appropriate patient and public involvement, meaning that you engage with healthy subjects and or patients at a very early stage to understand their perspective on the value of the research and the process of the research. So you need to sort of ask those patients, what would be acceptable to them, what would not be. They will provide you, patients are a phenomenal source of information about their own health conditions, but also about their own patient journey. And they can provide, understandably, a lot of information. I think a lot of clinical researchers overlook the value of patients and society in providing some shaping, in fact, quite a lot of shaping and steering around how the research should be conducted. And all of these things might then reshape your study objectives, your study goals, your outcome measures. Therefore, again, as clinical researchers, we have to be really open to being robust and being thorough, but also a little bit flexible and making sure that we've gone through multiple iterations of our protocols before we get anywhere close to the clinical study, and making sure that those multiple iterations have been approved and checked and improved by the ethics boards and ethics committees and other researchers, other collaborators. Again, you can't do these sorts of challenges on your own. It's about involving lots of people at that time. So in all honesty, to answer your question, I think the majority of clinical researchers do understand this, and they do allocate plenty of time and plenty of effort. But I think, yeah, all of us, particularly at an early stage of our career, it's easy to underestimate just how much work is required before we even get close to starting the clinical research we intend to do.
And I guess one thing you said just on reflection is the impact of collaboration. You know, you have to realize that it's going to take a lot of time, but even if you're early into your career and you're not exactly sure about something, you can use the team around you to kind of support you through that process. And even the aspect, I love how you mentioned patients and the public in there, because there's such a useful aspect. A lot of these clinical trials will involve them. So it's about, okay, not only utilizing the team around you of the researchers who have expertise and, you know, how to get the ethics approval, how to go through the infrastructure, but then using actually the people who will be part of the study to shape how you do it, to ensure it's delivered in the most, effective way. So I guess it's utilizing that team around you.
That's a really good point, Yas. And you've just reminded me about the collaboration, and coming back to a previous point about making this work sustainable and how do you do it, particularly as a foundation doctor or resident doctor or even as a consultant. We should all be aware, and I'm aware, and I've been very fortunate to have funding from the National Institutes of Health Research in the UK. So the NIHR and NIHR pathways are brilliant for doctors to be able, like an academic clinical fellowship is one of those. And later on, you might want to do a clinical lectureship where you work 50% research, 50% clinical work. So these pathways are nationally recognized, they're in place, they integrate really well with the traditional pathways for specialty training as resident doctors. They also have these great networks, to come back to your point. Not only should we get involved with the NIHR because we know that we might find opportunities to make our research activities sustainable and opportunities to step away from the traditional training paths, but we might then also find networks of individuals who can help us with similar trials. Most clinical research is done in networks now, and there are very, very strong clinical research networks within the NIHR framework as well. So yeah, you make a really good point about the collaboration, and I think particularly thinking about those pathways individually for us as researchers, they do provide good opportunities to make all of this a little more sustainable.
Really, and I think that's a nice shout out actually to NIHR on the pathways they provide, because that's something that, for example, doctors can get involved with if they're interested in pursuing research. I wanted to now kind of talk about your industry work and your pharma work, which I guess also relates to NIHR because I know they do a lot of pharma work too. But can you explain in simple terms what this means? Like, what do you mean when you said you've gotten involved in pharma and biotech, and why are medics valuable in these industries?
Sure, yeah, thank you. So there are many different avenues that one can take, and at many different stages of our career, because as you know, having a medical degree as a medical doctor isn't just an opportunity to look after patients. It's an opportunity to take a lot of detailed clinical and preclinical knowledge into settings such as the pharmaceutical industry. So I first got involved in pharmaceuticals. Actually, I was 17. I did my first internship during my A-level summer holiday. And that led to a number of great opportunities. That was with a large pharmaceutical company. And I had a great time because I started to see just how well resourced industry research can be. And it was actually the project that I did that really helped build me and shape me as a scientist at an early stage, a very young scientist. And I would say that for me, after that one, I then kept going back for internships for other departments in industry during my scientific early years as an undergraduate at Cambridge. Now, not everyone has this time, space, and opportunity to do internships, but I just want to make clear that I feel that they are a remarkable opportunity, particularly when you're in your student years, to get first-hand experience of building a network, experiencing the research, getting involved in your own projects, and just seeing that commercial environment, sort of how it runs, how it doesn't run, how it functions. Because the private sector, of course, is very, very different to the NHS, particularly with regards to biotechnology. So that's how I got involved in pharmaceuticals. And I've not been so involved since my undergraduate years. But to come back to the second part of your question, I've been involved in medical technologies now as an advisor to one company in particular. And the key thing to mention, this has been since 2019, really. The company is involved in artificial intelligence-based triage of primary care patients. And I got involved as what we call the UK medical advisor. Now, that's a title we made for me. It's a relatively small company. And my role is really to provide my clinical understanding to those developing the technology and trying to implement it within the National Health Service. And my clinical understanding is not just medical, it's like my understanding over the last 10 years of how the NHS works. Now, the first thing I must stress with this, I am a real stickler for making sure that we have a very clear separation between our NHS work, if we're at that stage, as I am, and any kind of commercial activity that we do. So for me, I currently work at 60% NHS time, leaving 2 days a week potentially available. And right now, I don't have so much activity, but potentially available for commercial efforts. I think the second part of your question was sort of how do you get involved in those? Was that right? So,
and why are medics valuable in those spaces?
Thank you for reminding me. Yeah. So I think medics are exceptionally valuable for two reasons. First of all, if you're literally coming out of medical school, don't worry, you're still exceptionally valuable because the medical programs that we study all across the UK and internationally are all about problem solving. They're all about simplifying complexity. They're about understanding challenges in difficult settings, difficult circumstances, and also about doing a really deep dive in our understanding of basic sciences and clinical medicine and surgery. So that's a pretty neat package that medical students, once graduating especially, can offer to industry. Because, of course, industry will be made up of a variety of people with diverse roles. There'll be engineers, there'll be finance people, business developers, managers, marketing, advertising, whatever it might be. So it's no doubt to me that medics bring a very deep but also very broad skill set to the technology industries, including pharmaceuticals. So I think that's why we're of value. Now, coming to, say, medtech startups, what you tend to find, and I've seen this through a little bit of volunteer work with the health innovation networks. These are parts of the NHS that are there to facilitate the implementation of clinical technologies into the NHS. What I've noticed is a lot of early stage medtech companies will have very few clinical interactions before their technology starts to gain momentum. It's really surprising, actually, just how many medtech companies are kind of created by perhaps business people and engineers with very good intentions and with great ideas, but they won't necessarily have a clinician on their team, and therefore any technology they're working on may not actually be appropriately contextualized. For example, they might not understand how the latest technology or the latest widget that they're working on will impact on other areas of a healthcare pathway, or how will it interact with different pieces of the system. So, and this is, of course, this isn't true for all medtech companies. This is just some of them, but particularly at an early stage when they're getting started. So, with very little networking, one can find themselves with perhaps a background like mine of both academic and clinical. But even if you're a purely clinical background, at a relatively, it doesn't take too many conversations to realize that you may have ideas, knowledge, understanding that's of value to the strategy and possibly the tasks that these companies need to do. And therefore, really at any stage of your career, but particularly once graduating medical school, it's entirely plausible to be involved in the medtech space while still continuing your clinical career. For example, I even had a conversation recently with the medical director at Deloitte, one of the big management consultancy companies. And she said very clearly that many, in fact, I think most of their clinical advisors still maintain their clinical career. So they do a portfolio. So even, if you want to go into management consultancy, for example, it is possible to do a bit of both. It's not something I personally want to do. It was an incidental conversation that I just found quite interesting. And again, how did I kind of have that conversation? Well, you go to events. So, for example, there's a healthcare event in London called Giant Healthcare. There'll be around 4,000 people attending next week on I think it's Monday and Tuesday of next week. I'm still tempted to go because there's free access for NHS staff. Um, just go to these events, get involved, start having conversations, and you don't have to be as chatty as I am to very quickly make new alliances and find that there's a lot of different projects and people who are genuinely, and I mean this, they are genuinely in need of people with some degree of clinical experience. Now, if you want to take this up a level, those of us who have got some specific niche expertise, I mean that can be really, really valuable. And you don't necessarily have to be a consultant doctor to share that. You could have either academic or clinical expertise in one area, and that can be really, really valuable for developing clinical technologies within companies. Of course, I'd always hesitate a little bit and exercise some caution. You have to be very selective about who you work with and how you work, as I've already mentioned, about that clear separation of one's time to make sure there is absolutely no conflicts of interest. Every interaction has to be done with integrity. It's important to protect yourself, get all the right indemnity in place, for example, if you're going to be an advisor to any kind of business or patient group or charity or whatever it might be. So yes, make sure one does it thoroughly. But again, plenty of networks out there to help make sure that happens. It's all about going to events, getting online, and just diving in, because you never know where the next conversation might lead.
Yeah, networking is definitely a big aspect of it. What would you say are the other skills that people should be trying to sort of brush up on when they, try to reach out to these different organizations? How can people sort of put their best foot forward, so to speak, in regard to getting these opportunities?
I think it's a good question, because I think we sometimes get a little how can I say, sort of shaped by our clinical environment. And the way we interact in clinical environments is naturally, potentially, the communication style can be very different in commercial environments. It's not like one's better or worse, or no, I'm not judging these things. I'm just observing that sometimes the style of interaction can be different. So I think one thing to brush up on is your own pitch. So understanding who you are and what you might be able to offer, particularly, for example, if you've got a subspecialization already in mind, if you're already working in one area of medicine or surgery or something similar, having that really clear, so that when you interact with someone briefly, within literally 10 seconds, they can understand who you are, what you're about, and what potentially you can offer. So, for example, I'll give you one right now. So, hi, I'm Dr. Nick Hayward. I'm a neuroscientist and medical doctor. I have expertise in medical imaging, and I understand your company is developing new medical imaging technologies. I also understand the NHS inside out. I've been a part of the NHS as a doctor for over 10 years. And therefore, if you're trying to facilitate the application of your technology within the NHS, I do understand the NHS quite well. So I may be of value to your company. Now, I don't know how long we just took there, Martin, but it's a very clear, quick offering that you can say. And if you understand what you've got and understand what someone needs, very quickly you start to make matches. I think, again, second tip on this is adjusting your communication style, as sort of hinted at. It can be as simple as going out and getting more experience in commercial settings. So by going to medtech events, pitching events, startup jamborees, whatever it might be, you start to sort of see how others communicate, and it's a little different from some of the ways we communicate in the clinical setting. And if you're just in that space, just surrounding yourself with people of a similar mindset, very quickly you find that you can kind of get along. And then if you can get along with people, those people you get along with are more inclined to want to work with you. So yeah, I hope that sort of gives some pointers of how to get started.
That's really useful, actually. And I just wanted to come back. So a lot of the times you mentioned how even straight out of med school, you can be an asset to these kind of organizations, industries, from pharma to biotech to medtech. But they often can feel like outsiders when you're med school because, as you said, you're kind of drilled in to become a doctor. That is kind of the main path they tell you to go down. So what are kind of the biggest misconceptions do you think medics have about these industries and working with them, utilizing your experience?
Yes, I think there are a lot of misconceptions around when. So the big one is, so when am I ready to dive into industry? I think personally, again, I'm all about integrity and doing things to a high standard where possible. I like to make sure that the opportunities we all have as doctors are robust. Therefore, the when is a real tricky one because most of us as doctors think, oh gosh, I need to be, a clinical consultant. So, completed my clinical registrar years with many years then of additional experience and so on. I need to have at least 20 publications in the field and 5 years worth of experience in a certain domain. And then it starts to get like this overwhelming career that may sort of take 30 years to orchestrate. The first answer is that is not necessarily required. We all think like that because as medics, we're all quite self-critical, I think, most of us. And I think most of us want to really feel very sure, sort of evidenced in the opportunities we take. And I'm definitely like that. I like to do things well. And the honest consideration there is that actually, as I have done, now I'm a little unusual because I have an academic career as well, but if you're purely clinical, I think after medical school especially, you can already start to be of value at an early stage. And the hardest challenge is to say, again, the other misconception is not just when, but knowing that there is no when. There is, depending on the opportunity, potential opportunity at every stage of one's clinical career. But not just when, it's kind of thinking about sort of how do you do it? You don't have to, as I've sort of hinted at with many companies, you don't have to necessarily stop your clinical work or your clinical progression. One can potentially, with very, very careful scheduling, making sure that's crystal clear, you can schedule extra work or different work outside of your clinical work. And therefore, you don't have to quit medicine to necessarily go into the tech industry or the pharma industry. Also, to be aware, particularly with pharma, there is a clinical subspecialization of pharmacology, or rather, it's pharmaceutical sciences, I believe, and you can be a pharma medic, and it's an NHS pathway, and you spend most of your time in industry. So as you become a pharmaceutical consultant, essentially. And so that's a pathway to consider for those that really are interested in pharma. That's something you can do after your foundation years. I think that's when you can enter that pathway. I think it's a 5-year pathway, but we can check those details. It's not a pathway I've tried to explore. So those are some of the misconceptions, I think, around when and how. You don't have to quit medicine, and there are potential opportunities before you become a clinical consultant.
Oh, that's really useful. And I guess it just aligns exactly with what More Than Medics is about too, because what we're trying to promote is the fact that you don't necessarily have to quit medicine. You can use medicine as your launch pad to explore these other diverse opportunities, which is exactly what you've explained.
Yeah, and then also in regard to your work with, or you've written some articles about healthcare environment design, like clinical environment design, which never really occurred to me. But yeah, the wards do need designing, don't they? I guess in an optimal way. Could you tell us a bit more about that, actually?
Yeah, sure thing. So I had a short collaboration with an architect who was very interested in this space, and we ended up writing sort of more popular articles around the need, really just the need. For a long time, I've been fascinated by architecture and interactions design, just as a side interest. So this idea that we can be more healthy if we consider clinical environments from patient perspectives and from the perspective of holistic care. And this doesn't have to be abstract. This can be literally about how functionally we design and interact with our spaces, how that can make us feel, hopefully, just more peace, more calm. It's really that simple. And astonishingly, again, historically, I think a lot of healthcare spaces have been designed. Really, there may have been some sort of gaps between the healthcare spaces themselves and the designers who are involved. So I'm very keen on bringing all of those different experts together to make sure that we are designing our clinical spaces with all of the different users in mind and trying to make those environments as healthy and uplifting as possible. Because the more we can get away from the traditional hospital model of sort of very sterile environments, I think the more likely we are to give patients a better experience during their inpatient stay or as outpatients or in primary care. So I think it's got a lot of mileage. Again, I'm not the only one interested in this space. There are plenty of clinicians who have gone in that direction and are now advisors. I'm not an advisor at this stage, but I'm very interested in the topic. They've gone and advised directly either projects locally within their within where they work or with companies that they're affiliated with. So yeah, there's definitely a space for medics to get involved in what I would call the interactions design of healthcare spaces, because we just have a knowledge of the patient journey. We have a knowledge of the staff journey. We have a knowledge of how healthcare pathways come together. And that way, as medics, we can try and make sure that our spaces that we work in are not only just fit for purpose, but they are optimized.
Seems like something that should already be happening, to be honest. Like it's so important, just like as you said, creating that atmosphere not only for us as clinicians but for the patients, most importantly, so they feel welcomed in that atmosphere. And that actually reminds me of we did a project in medical school actually for third year where the university collaborated with another university with architecture students, and we had to do a project where we got given a task of a ward. It was, for example, like a stroke ward or dementia ward, and you had to kind of redesign the space to fit the users. And I remember at the time thinking, okay, like usually when you're in med school, you're thinking about your exams, like how is this relevant to your exams, you think at first. But then actually when you realize it is so important to think these are the simple things that you can do and make a difference to then impact that patient's, like, you know, even just quality of life in general, just the quality of them coming into the hospital, feeling comfortable. And that can impact your consultation. If they feel more comfortable, they're probably more likely to open up to you, feel less stressed in that environment. So I think it's something that's really interesting. And I love the fact that you've used, most importantly, something that you're interested and passionate about, and seeing, okay, how can I use my experience then to make a difference in that area, which I think is really nice. And you can just apply that then to your other passions as medics that we have.
Yeah. I do like, I just want to add as well. Yeah, I do like how I get this vibe that you're sort of slotting yourself into different areas that clinicians are probably needed, aren't they? So like investors, they probably need a bit of clinician insight. Healthcare design, they'll need some clinician insight. Med tech, whatever it is, consultancy, safety work in regards to drugs and technologies, they'll need some clinician insight. So I do like that sort of where you're thinking, okay, where are we needed? And I guess where can I go as a result?
But most importantly, the fact that you're doing it in areas that interest you, that like you're actually passionate about. I think that's the key thing, because it kind of comes back to what you said earlier in terms of doing something that kind of, well, I guess it'll align with what you're going to say next, coming on to our final topic, is choosing things that align with your values. And actually I wanted to ask if you can go into that a little bit more, because I know you're kind of passionate about how do you navigate your career to suit you and suit your values.
Yeah, sure thing. No, thanks for your contribution on those topics. I think, yeah, I've just noticed it now, how you've described how whatever I've tried to be involved in, whether, you know, it's the healthcare interactions through writing some articles jointly, freely, I wasn't paid for that. This was just something I got involved with through a passion, through someone working with someone who is an architect, and the two of us worked together as co-authors, and it was a lot of fun. And coincidentally, just on that topic, I'd say that there's good research evidence out there in more the social sciences that actually you can have a reduced length of hospital stay if you design the environment well. So that there's direct healthcare benefit based on the articles that we created. We did our literature searches and so on. We found that there's good evidence that there is direct healthcare benefit to optimizing our spaces in which we work, but also for staff.
Mm.
So, staff sickness was reduced in certain carefully designed healthcare settings. So anyway, I can't quote the literature verbatim today, but I remember at the time when working on those articles, it was absolutely fascinating. So one thing that's always up my sleeve is this idea that I'm working with data, I'm working with literature, I'm trying to use published evidence to research to help me in my advisory work. So having that basic science background to bring it full circle, it for me has always been very beneficial. Another reason to say that it's worthwhile to do PhD if you're inclined that way. So you're right. The passion is where it all comes together. Now, where does the passion come from? What's the motivation? Motivation is the most interesting concept. And coming on to your question about values, we're all motivated to do different things for different reasons. And it was relatively recently that I sort of took a long, hard look at myself and thought, what's driving, for example, at the time, it was what's driving the motivation to become a consultant anaesthetist. At that time, I was thinking of becoming an intensive care doctor, in neuro intensive care because I had an interest in the brain. But then I put a pause on things and went back to research. And I was like, what's driving this? Now, fortunately for me, I've been very fortunate. It's usually pull factors into the next opportunity. If the next opportunity looks tasty, then that's great. I might just go and take a bite and see what happens. And usually for me, I've managed to make something interesting, which is wonderful. But then why did I then come back into clinical work after that? And I started to think, well, this is interesting. And I came into another specialty, and now I've been doing, radiology for clinically for over 3 years, having been involved in radiology research since 2006. So, what's going on here? Why the slight changes? Why the combination of clinical and academic work? So I thought I need to try and figure this out. What are, yes, there's enthusiasm, yes, there's energy, yes, there's passion. And I have always been motivated by my interests. But then I realized within me that actually what matters more, and I think it was the challenges that everybody faced, some more than others, of course, during the pandemic. Really, families were blown apart by the pandemic. And I realized very slowly, I think over the last decade, but particularly during the pandemic, that there's so much more to life than just these careers decisions.
Mm.
And therefore I realized, oh, I need to think about what do I value most, and figure out personally by doing, and this is how I did it. So what I did was I tried to figure out personally through interacting with a lot of different people who know me very well, asking them what they thought might be driving me, doing some personality-based assessments such as 16 personalities or Myers-Briggs based assessments, doing other online activities, of which there are many, where you can start to figure out what is really driving you from within. I got involved in the concept, or I got reading really about the concept of designing your career. So there's a whole school of thought coming out of California, where the researchers of, I think they're at Stanford University. They have this whole idea that you can design your life in terms of your career, and that actually, rather than chasing down the next exciting opportunity, you start to sort of take a step back, evaluate yourself, and figure out which of these activities, not the topic, but the activity that you do in the job, what do those activities look like on a daily basis, and how do they align with who you are as a person, i.e., the way your mind works, the way your brain functions? Do you prefer team working? Do you prefer working solo? How good are you in those very challenging situations of managing, for example, in healthcare, like a sick patient in front of you? How do you take care of that person? How do you interact with the team? How do you respond to those circumstances? And then you think to yourself, well, hang on, actually, my core values really need some defining. So then literally, with enough work on yourself and looking and reflecting, we're very good as doctors at reflective practice, of course, you start to generate a bit of a list, and not just any old list, but like a kind of priority list. To give you one of my core values, I'm very passionate about autonomy. So the ability to be self-directed, both in my career, but also in my personal life. But I'm very passionate about supporting the autonomy of others. It's part of what makes us good doctors, I'm sure. So when I realized this, I thought, oh, maybe I need to be working in environments where it's possible to work solo, where it's possible to coordinate my time. Other core values pointed me towards the need to have a bit of a portfolio, whereby there are, I can't completely, the reason I moved between clinical to research and back to clinical was because I like both. It's as simple as that. And there were different elements within there that illustrated to me, well, actually, a portfolio is just suitable for me personally. So then you go, oh, okay, right. So, and I won't go into too much detail, but there were elements within my personality that aligned best with actually having a variety of activities. Therefore, building and designing towards that over time. For example, going less than full time. I've been full time for 3 years in the clinical space, but I've come back now recently to less than full time. Again, engineering and designing that. What does my life look like? Again, it gives me that sense of autonomy, and it gives me that variety, and it's the variety that satisfies a number of other core values. Now, I'll be honest, you can correct me on this, both of you. It's not something we really talk about at medical school. Maybe I'll pause there and get your insights. I mean, is there, when I was there, I mean, I don't know how it's changed in the last 10 years, but is there much emphasis given to self-exploration?
I'd say no, to be honest. Rather a lot more emphasis on you're here at medical school to then become a doctor. And then this is the pathway you need to choose. This is the specialty you need to choose, rather than, like you said, that focus on, okay, who am I? What drives me? What drove me to do medicine? What drives me to do my different hobbies, etc. And then how, aligning that then with the opportunities you choose. And like you said, redefining that career. We don't really get much of that, actually, which is hence why we decided to kind of start this, because we wanted to explore that area further. I think a lot of, like you said, a lot of people out there, one reason why there are people out there now trying to leave medicine is because they are in that same position as us, where they're like, okay, maybe they have other interests, but they think then because med school drives you that you need to do medicine and medicine only, that they have to leave medicine to then explore that, which is not the case. And then it's like you're linking to what you're saying. If you can understand your own core values, you can then choose the opportunities and choose the things that align with that. So then not only is that making you more satisfied, probably also less burnt out as well, which is very much needed in the NHS at the moment. But it means, again, like you said, you can really then craft that career for you, and that's personalized towards you, and it's flexible as well, and it's adaptable. Because I guess one thing I'm just thinking of is those core values. Would you say those core values change as over time as well? Or do you think those core values are kind of instilled from us from young?
It's a great question that many psychologists will debate. My reading of the literature on core values is, some say, and I think I'm fairly aligned with this, that if you dive deep enough within yourself, you will find that there are some certain values that are immovable objects. They are deep rooted within us. And if you do a deep enough dive through some of the activities I've mentioned and many more, spending time with a psychologist or just, as I say, anyone who has an interest in this space, it doesn't happen overnight, but it can be a process where you learn a lot about those deep-seated core values within you. And some say they are, that they are fundamental to who you are. They're part of your personality within. And again, I think ignoring them or being, not ignoring deliberately, but sort of being less aware of them can lead to decisions that perhaps are not aligned with who you really are as an individual. Now, let's be clear. It's never going to be perfect. There's no utopia here. All careers decisions come with some positives, some negatives, some pros and cons. But I think if we at least pay just as much attention to ourselves as we do to the shiny ology that medics might move towards, which specialization will I like that ology? Cardiology, gastroenterology, whatever ology it might be. For me, it's radiology, of course. My key message here is that I think those core values are deep-seated within us. I don't think they change too much over time, but perhaps we become more aware of them, or perhaps as our lives change, they drive different core beliefs, which is the next step, and then core needs can come from that as well. So those are sort of the next level up, is sometimes the things we believe in and the things we think we need and the way or the way we are in society can definitely be shaped by our environment and our personal circumstances. But again, we're only going to figure those out if we spend time understanding ourselves. And honestly, it doesn't have to be, a massive experiment or some life-changing event or an enormous realization. I just advocate that we spend just as much time evaluating ourselves as we do evaluating the opportunities that we're making or creating or taking in front of us. That's my key message. Evaluate ourselves just as much as we evaluate the opportunities ahead, because then that way we're not drawn towards the shiny objects for inappropriate reasons. We're drawn towards opportunities that are aligned with who we are. Again, that just makes them more exciting. Perhaps we're going to have the motivation to do them. Perhaps they're then going to be more sustainable. And I've been fortunate enough to realize this philosophy at a still a reasonably young age.
I love that message. Yeah, I think I'm probably going to take that from you, actually, that phrasing. That's really good. And I think that's really good practical advice, I think, as well, that you've given early in terms of actually just kind of reflecting on yourself, using what we are taught in med schools to reflect on yourself, speak to others around you who know you very well, asking their opinions, do those things like personality tests online. And I think you're also just reading about it more. I think this is an area that's not really discussed that much, but there's definitely literature out there. So I think for medics who are probably listening, I think just go ahead and do that research. Like, don't be afraid of it, because I think a lot of the times we're sometimes afraid of reflecting on ourselves. So I think, yeah, that's really useful advice. And just to kind of finish off this podcast, which has been amazing, honestly, eye-opening for me, what's one key message or piece of advice you'd want to leave medics who want to now explore that diverse career path, other than obviously the advice you've just given before about the core values, etc.?
Sure. I think the biggest piece of advice is to enjoy the journey of exploration. And what I mean by that is, please do not be afraid to have conversations with engineers, architects, business people, marketing professionals, diplomats. I was recently fortunate enough to be invited to an event with an ambassador. And you think to yourself that the kinds of conversations you can have with people from so many different backgrounds will inevitably expand your own curiosity, your own horizons. And I think, again, if we do that while understanding ourselves, there's a lot of exciting opportunities out there to design a career in medicine, with medicine, or around medicine. The message is, don't be afraid to have those conversations way beyond the walls of the hospital.
Awesome, Nick. Such great advice. Is there anything else you'd like to add as well on top of that?
I think I'm running out of ideas. No, I'm very grateful for the opportunity to share, some of my journey and some of my thoughts. I'm still learning, I'm still growing. Of course, we all are. And I think I'm trying to just enjoy the journey, because the curiosity within me is still there. And despite sort of moving on in my clinical career and my academic career, it's that curiosity is still strong. And I think if you can somehow figure out what is genuinely motivating us, then I think that's helpful when making these big decisions around careers. And don't be afraid. Like I say, do not be afraid. As Jasmine said, don't be afraid to do that self-evaluation, have those conversations, and just try and enjoy the journey.
Amazing. Thank you so much, Nick, for your time. It's been an absolute pleasure. And we look forward to keeping in contact and seeing the amazing work you get up to.
Also, just to finish, just to finish as well, how can some of the viewers of the podcast get in touch with yourself or follow up on some of the topics that you've been talking about?
Sure, yes. So first place to find me is my own website. I'm drnickhayward.com. You can also find me on Instagram, the same handle. I'm also, I've got an emerging YouTube channel, so where I share brain health, one of my big passions, of course. So I'm on YouTube again at Dr. Nick Hayward. I'm also on LinkedIn, so I'm very chatty on there too. Multiple ways to find me. I'm relatively visible online through my research publications as well. So do not be shy about reaching out, because I'll be happy to help others. I've helped lots of people over the years, and I will continue to do so, because, like I say, it's all about the journey.